Hare Krishna.
Hare Krishna.
Hare Krishna to all the participants who have joined in the today's session, that is the today's podcast, to yet another exciting topic on health, which is live on Hare Krishna YouTube channel. I am Yograj representing Bhakti Vedanta Hospital and Research Institute, which is a 300-bedded multi-speciality tertiary care NABH accredited hospital, which is located in Mira Road, Mumbai. We offer holistic healthcare services for body, mind, and soul with the advantages of allopathy, Ayurvedic, homeopathy, and alternative medical therapies under one roof. We integrate modern medical knowledge with holistic approach to promote overall well-being. Our experts emphasize the importance as a cornerstone of preventive healthcare. This podcast is our initiative, which is under our flagship program, ISKCON Devotees Healthcare Services. This program was launched in the year 2023 at ILS Mayapur. Under this program, 3,000 plus devotees have taken the advantage for their healthcare needs. Today, we will be discussing on the journey of brain tumor from diagnosis to prevention. On this podcast, to address the basics and more in depth aspects of the topic in a way that will be engaging and informative. Let me welcome our esteemed guest and speaker, Dr. Raghvendra Ramdasi, Head of the Department
Hare Krishna.
Neurosciences and Consultant Neurosurgeon. Let's begin our live podcast.
Hare Krishna.
So we'll start about the introduction and understanding about brain tumors.
Yeah.
So can you explain what is a brain tumor and how does it differs from other type of tumors?
Yeah. First of all, I will like to introduce myself. My name is Dr. Raghvendra Ramdasi. I am MCH neurosurgeon. I did my MCH from KEM Hospital, and I did a fellowship in brain tumors and skull-based endoscopy from Italy under Professor Capabianca. I've been practicing in this esteemed institute for last 3 years, and I'm very happy offering my services to all the needy patients over here. Let's talk about the brain tumors, as you said
Yes.
rightly. So basically, brain tumors are like other tumors,
Correct.
right? So tumor is actually what tumor is indiscriminate growth of a cell, which is not controlled. So we can say that it is uncontrolled and indiscriminate growth of any body cell.
Correct.
So as you asked me, how the brain tumor differs from the other,
Yes.
because brain tumors are not so common as compared to the other tumors in the body.
Right.
So the incidence is around 4 to 5 per 1 lakh. So it is not very common tumor,
Right.
but it is most feared tumor in the body.
True.
Why? So there are, first of all, we should know the constraints of brain. So brain is basically enclosed in a very tight shell, tight cavity. We call it as a skull. Skull. It's a bone, hard bone. So brain has very little capacity to grow outside the constraints of the skull. So that is one thing. Second thing, brain by nature, by God, it has been completely isolated from the rest of the body, because anything we consume, anything we inhale should not reach the brain.
Correct.
So there is a barrier between the brain and the rest of the body tissue.
Correct.
We call it as a blood-brain barrier. So let's not go into the details of it, but so this is the anatomical and the physiological barrier, and the same applies to the physiology or pathophysiology of a brain tumor.
Right.
So any growth in the body, it is manifested very late because it has space to grow.
Okay.
So in brain, as I have already told, that brain has a very little space to grow. So any smallest of the growth is manifested.
Correct.
So that is the main symptomatic difference between the rest of the body tumors and the brain tumor. That is one thing.
Yeah.
Second thing, brain is like mathematics. Brain is only mathematical organ in the body.
Yes.
It is very logical, in a sense that if there is something in the brain, it will manifest.
Correct.
Okay, a smallest of the smallest lesion, smallest of the smallest infarct, or anything in the body is manifested.
Correct.
The vice versa is also true. If there
Yes.
is some weakness, there must be something in the brain, the
Yes.
opposite side. So, coming to the point, so any smallest of the growth is manifested in terms of the symptoms. For example, if there is a small lesion in a speech area, I'll tell you in details about the areas of the brain.
Right.
So, if there is a small growth, then there will be aphasia, means the patient is unable to talk.
Okay.
If you go and do MRI, there will be 1 centimeter or less than a centimeter growth. So that is the main difference, that the brain tumors manifest very early. One thing. Second thing, the brain tumors have a different the pathophysiology is slightly different. Um, from surgeon point of view, we cannot operate the brain tumor from outside.
Correct.
Because there are some vital areas of the brain, I cannot damage that area.
Right.
So surgically also it differs. For example, if you remove a tumor from the stomach, you can remove some part of the normal tissue around it.
Right.
But I cannot do it in the brain tumor.
Yes.
So I have to grow from within outwards, in the other parts outwards within. So that is the main difference.
Correct.
This is a disadvantage.
Disadvantage.
Yeah. Other disadvantages, as I told you about the blood brain barrier. So the chemotherapy which we give, the drugs which we give, they seldom reach the brain. It is difficult for the chemotherapy to reach the brain. So we have to give in some different dosages.
Correct.
Or we have to choose such drugs that they actually happen to transgress this barrier and go through that barrier and reach the brain.
Correct.
So this is a disadvantage again.
True.
So
Absolutely.
to in nutshell, basically tumors, they manifest early.
Correct.
They are different surgically, and the drugs also we have to give differently.
Correct.
So this is the difference between the brain tumors in the brain tumors and the rest body tumors.
Correct. Correct. Right. So my next question is, what are the different types of brain tumors and how are they categorized?
Okay, so for that we need to know the the anatomy in means not in details, but at least first of all I go to the classification.
Right.
So basically, as we know, the malignant tumors in the body, they can metastatize any part of the body.
Correct.
But brain and lungs, these are, and liver also is a very common, they are very common sites of metastasis. Why? Because it is richly supplied by the blood.
Correct.
So blood supply is very rich.
Yes.
As we know, the brain requires a lot of blood, lot of energy for the day-to-day activities. Also for the high-end activities it requires more blood.
Right.
So this is a disadvantage again, because any part of the body, if there is a malignant tumor or cancer in layman's word,
Right.
that will go preferably to the brain.
Correct.
So the metastatic tumor or the secondary tumors are very common, or they are the most common tumors in the body.
Right.
In the brain. So these tumors are called as secondary tumors because they are arising from other part of the body.
Correct.
So the primary brain tumors are less common as compared to the secondary brain tumors.
Okay.
So primary tumors, they are again categorized depending upon the site of their origin. For example, there are tumors which arise from the coverings of the brain.
Okay.
We call it as meningiomas. Okay, so there are many subcategories, but we don't want to go into the details. The meningiomas arise from the coverings of the brain.
Right.
Then the inside of the brain, there are the neuron cells. We call it as the tumors arising from, they are neuronal tumors. Okay, there are supporting cells. There are some supporting cells. We call it as glial cells.
Okay.
So tumors arising from them, we call it as gliomas. Okay, so basically they are divided into these broad categories.
Okay.
In nutshell, secondary tumors, primary tumors again divided by the site of origin.
Okay.
Okay. If you see the incidence of the brain tumors, the most common tumors are secondary tumors, but the most common primary tumors are the glial tumors.
Okay.
So we can say that the tumors which the cells which are primarily responsible for the brain function, they won't cause tumors, the neuronal cells.
Okay.
The supporting cells, they are responsible for most of the tumors in the brain, primary tumors in the brain. we call them as glioma.
Okay.
Okay, so the gliomas constitute 50 to 55% of total primary brain tumors.
Okay.
Then around 15% of the cases, meningiomas are the second most common tumors.
Mhm.
The 8 to 10%, they are pituitary tumors. We'll go into the details as we progress. So the pituitary gland, as we know, is a master gland situated in the base of the skull.
Brain.
So it is responsible for all the endocrinal control of the body. So these tumors arise around 8 to 10%. They arise from there,
Mhm.
from the pituitary gland. They are benign tumors. And the lastly, acoustic schwannomas, or we call it as vestibular schwannomas. They arise from the nerve which balances the body, vestibular
Okay.
nerve.
Okay.
So they are the fourth common tumors.
Mhm.
So you got the point that how it is classified and
Yes.
what are the incidences of
Correct.
the brain tumors.
Right. Absolutely.
Yeah.
So, what are the common symptoms that might indicate if someone has brain tumor?
Correct. So the symptoms, for the symptoms, again, we need to know slightly about the anatomy.
Correct.
The meningiomas, the gliomas, these are the most common tumors.
Mhm.
Then the pituitary tumors, then the acoustic schwannomas. We will go one by one,
Yes.
because the meningiomas, basically, they arise from the convexity dura, or the dura which actually envelops the brain. Basically,
Mhm.
we call it as the convexity.
Right.
Okay. uh, for these two tumors, what the symptoms caused by these two tumors, we need
Mhm.
to understand the anatomy and the functions.
Mhm.
Okay, so as we know, there are 5 lobes. So basically, we divide the brain into cerebrum and cerebellum. We call
Okay.
it as a small brain, hind brain, which is a cerebellum, which is situated behind, and the cerebrum, which is situated above. Okay, so we divide the cerebrum into again 5 lobes.
Okay.
Okay, so the frontal lobe, which is in the front,
Mhm.
no? The temporal lobe, which is on the side,
Mhm.
the parietal lobe on the top, the occipital lobe behind,
Okay.
and one more lobe is there, insula, which is deep in the sylvian fissure, which the function of which is very obscure. It is not very well known.
Mhm.
Uh, the frontal lobe, which is the front part
The
of the
forehead part.
forehead part of the
Mhm.
brain, it is responsible for your personality.
Okay.
So whatever you are, it is because of the frontal lobe.
Okay.
So the personality which you possess
Mhm.
is the frontal lobe, which represents your this personality. So that
Yes.
is one thing.
Right.
The memory function, it
Mhm.
is also represented in frontal lobe.
Mhm.
The motor function, it controls the opposite side body movements.
Correct.
Okay. Then on the left side, which is a dominant side.
Mhm.
Why dominant? Because it controls your language function.
Correct.
So what is the language function? If I ask you, what is your name? You will
Mhm.
say, I'm Mr.
Yogaraj.
Yogaraj. Yeah.
Yes.
So there are 3 components in this answer. First is to understand what I have asked,
Mhm.
right? I asked your name.
Correct.
So that is the understanding part of it.
Right.
That is, understanding is controlled in the temporal lobe,
Okay.
in the this part of the lobe.
Correct.
Then it has to compute, it
Mhm.
has to integrate your response.
Right.
The question should be analyzed, right?
Mhm.
That portion is done in the depth of the sylvian fissure, or we call it as a arcuate. It's a very technical term again. I don't want to go into the technical term. The adjoining area of the temporal lobe and the frontal lobe.
Mhm.
So the frontal lobe is responsible for the speech, whatever
Okay.
you are telling me.
Mhm.
It is the expressive part of the language.
Correct.
Okay. So 3 parts.
Mhm.
One is understanding part, second is computing,
Compute.
analyzing
Yeah.
part, and third part is the expressive part.
Okay.
There are other parts like writing, reading. This is also done in frontal lobe. So
Okay.
basically, all the expressive parts
Mhm.
of the body, the speech, the writing, reading, everything is situated in the left frontal lobe.
Loop. Okay.
Okay. So this is language on the left side.
Yes.
Then the personality, then the memory, then the motor function. So most important lobe in the brain is a frontal lobe. So we can make out what would be the symptoms of the frontal lobe
Mhm.
tumors,
Right.
right? One is the personality change,
Correct.
behavioral change,
Hmm.
then the memory loss, right?
Right.
Left side there will be some kind of aphasia. Aphasia means difficulty in articulating the language or
Correct.
understanding the
Understanding.
language. Okay, so
Yes.
this would be there. There will be some kind of hemiparesis, or
Mhm.
we call it as the weakness of the
Yes.
opposite side
Right.
of the body.
Right.
So these are the basic symptoms of the frontal lobe tumors.
Mm-hmm.
Okay, then we'll go to the temporal lobe.
Correct.
Okay, on the sides. Okay, temporal lobe is basically responsible for very higher functions like memory.
Mm-hmm.
Means the memory is the day to day memory, just like what did you do 2 hours before. So if I ask you, the frontal lobe will be the activating part of
Correct.
the brain. So
Right.
that is a day to day memory.
Right.
But if I ask you, when did you get married, so that portion of the brain is a
Yeah.
temporal lobe.
Okay.
So that will control your storage of the memory,
Right.
right?
Correct.
Then the higher mental functions like music, like if you write a poem.
Mm-hmm.
So this is very innovative part of the brain.
Mm-hmm.
It is the temporal lobe.
Correct.
Okay, so this part will be the, and one more thing, this is a very sensitive brain, because it is newly developed brain over in
Right.
the evolution. If you see, this is the
Yes.
very newly developed brain.
Absolutely.
Okay, so this will cause seizures or convulsion because it's very
Okay.
sensitive.
Hmm.
So this is very prone for causing convulsions. There are very types of convulsion. Again,
Hmm.
it's in details. It complex partial seizure is a very typical of the temporal lobe
Okay.
epilepsy. So
Okay.
this is a very common site of the tumors in the temporal lobe will cause this complex partial seizure.
So, is Parkinson's also included in that?
No, Parkinson is something is very specific for
Right.
basal ganglia.
Okay.
So it's a very specialized thing.
Yeah.
We will talk about it in a different lecture, I think.
Got it.
Let's focus on the brain tumors.
Yeah.
Then the next the part of the brain is a parietal lobe. It is situated on the apex, on the top of the
Hmm.
brain.
Hmm.
It controls basically the sensory functions of the brain, right? It controls again the spatial. For example, if I ask you, what is your right side, what is your left side,
Hmm.
you are able to tell me the right side, the
Yeah.
left side.
Right.
This right left orientation is also the spatial part. Where is your foot? Is your foot grounded
Yes.
at present? So
Yes.
you need not see your foot right now. Yeah, you
Correct.
know, right? So
Yes.
this knowledge is because of the parietal lobe.
Okay.
So again, this the tumors of this lobe will cause the problems with the spatial the knowledge or spatial
Correct.
understanding.
Yes.
That is
Right.
one thing.
Right.
Second thing, it will cause some kind of apraxia, we call it as. We don't know where is our right side, where is left side, or right left confusion, we call it
Right.
as.
Right. Correct.
So this is about the parietal lobe.
Hmm.
The lastly, it is the occipital lobe, which is situated behind.
Hmm.
So this occipital lobe is responsible for the vision.
Hmm.
All everything you see from the eyes, it goes through the retina to the optic nerve, and it is represented in the occipital lobe.
Thumbs.
Everything, size, shape, the color,
Right.
everything. So
Correct.
that would be vanished, or it would be diminished by
Mm-hmm.
the occipital lobe tumors.
Okay.
So this is about the cerebrum. If you go to the cerebellum, the lower part of the brain,
Hmm.
hindbrain, it is responsible for balancing.
Okay.
It is actually a response. As you know, you must have seen the orchestra.
Yeah.
It is the anchor of the orchestra.
Hmm.
So everything in the body is basically controlled, the balanced
Hmm.
by the cerebellum.
Cerebellum.
Even the speech, the volume of the speech, the articulation, the right spacing, what we call it as, it
Right.
everything is represented, or it is controlled by the cerebellum.
Correct.
So there will be some kind of ataxia or
Okay.
imbalance if
Right.
the tumor comes from the cerebellum.
Okay. Okay.
Okay, so this is about the cerebrum and cerebellum.
Cerebellum.
Now, very important part of the brain we need to discuss about it is a brainstem.
Hmm.
So what is brainstem? Brainstem is situated in the center of the brain. In the center of the brain, it is the source of life.
Okay.
So whatever we breathe, whatever our heart beats, whatever we open our eyes, we are conscious, we are aware of the surrounding. It
Hmm.
is because of the brainstem.
Okay.
So tumor of this part of the brain is
Hmm.
they're very dangerous tumor.
Correct.
So it can cause cranial nerve palsies, like the seventh nerve palsy or third nerve palsy. It's in details, but there will be some facial deviation. There will be difficulty in deglutination, difficulty in breathing, difficulty in walking.
Right.
So all the things, the day-to-day activities will be hampered. Even the respiration might be hampered.
Correct.
So they are very dangerous tumors. We call it as a brainstem gliomas or brainstem tumors, basically.
Okay.
So this is some elaborate discussion about the brain tumors and the symptoms of the brain tumors.
Hmm. So the name itself, tumor. So all tumors are like cancerous, that is metastatic.
Yes, it's a very good question. As we have already discussed, the secondary tumors, they are all cancerous tumors because they are coming from the other part. They
Other
are
parts.
foreign to brain.
Yes. Right.
Okay, so they are definitely cancerous. One thing. Primary tumors, 50% of the tumors,
Hmm.
they are gliomas. Rest 50% of the tumor are different tumors which we have discussed, like
Yes.
meningiomas, vestibular schwannomas, pituitary adenomas,
Huh.
and there are many tumors,
Right.
but these are the main tumors. Um, so 50% of the tumors
Hmm.
are gliomas.
Hmm.
In these 50% of the tumor, most of the tumors, we grade them, means grade 1, grade 2, grade 3, grade 4. These are the WHO grading of the tumor.
Okay.
So the grade 4 of the gliomas,
Mm-hmm.
they are the cancerous tumors.
Okay.
Okay. So rest of the tumors, grade 1, grade 2, they are precancerous.
Hmm.
Grade 3 is in between the cancer and non-cancer.
Non-cancer.
Okay. And grade 4 are definitely cancerous or
Cancerous.
malignant tumors.
Correct. Right.
So in nutshell, most of the brain tumors, we can say that they are non-cancerous, primary brain tumors.
Got it.
So we should not fear about it,
Mm-hmm.
right? We should definitely think positively,
Right.
and we should go ahead with the present treatment modalities. We will
Correct.
discuss about it,
Yes.
about
Yes.
the present
Absolutely.
treatment modalities,
Yes.
but you should not fear about the brain
Correct.
tumors.
Right.
So that is
So if someone is has like detected,
Hmm.
so what are the test or the imaging methods which are involved?
Right. So previously we used to, before the era of the computed tomography, we call it
Hmm.
as a CT scan. Uh, our teachers used to do carotid angiography. They used to puncture this carotid
Right.
and see for the tumor blush. But thankfully, the different modalities have developed, like CT scan.
Hmm.
But CT scan again is a not a very accurate diagnostic tool
Hmm.
for detection of the brain
Detection of
tumor.
brain tumor.
But what is the diagnostic modality of choice is MRI, magnetic resonance imaging.
Correct.
Huh? We inject the dye in that. So MRI, brain, plain plus contrast. This is the imaging of choice
Mm-hmm.
for most of the brain tumors.
Okay.
Most of the brain tumors.
Right.
CT scan is required to assist the diagnosis,
Hmm.
like to see the calcification, to see the bony landmarks
Hmm.
around the tumor,
Right.
or to see the hemorrhage or bleeding inside the tumor. These are some what you call it as the diagnostic requirements we fulfill with the CT scan.
Correct.
Right. So,
Got it.
but main diagnostic tool is MRI.
Mm-hmm. So, what should someone, if they are suspected, if they have the brain tumor, so or notice the unusual symptoms?
Yeah.
So,
So for that, what are the red flags?
hmm.
What are the
Yes.
symptoms for which you should consult a neurosurgeon? You
Correct.
mean to ask.
Yes.
So for this, we need to know the commonest symptom of the brain tumor is headache. Okay. So every headache is because of the brain tumor? No.
No.
Most of the headaches are non-tumorogenic headache,
Hmm.
right? Most of the headaches are because of indigestion or migrainous headache or some sinus problem.
Right.
These are the most common causes of headache.
Hmm.
These are all tackled by the our esteemed neurologists.
Correct.
Okay, so what are the red flags in the headache?
Hmm.
So what headaches to be reported to a neurosurgeon
Hmm.
or to be reported on emergency basis?
Hmm.
So first is early morning headache. If you get the headache as soon as you wake up, okay, so that is a very alarming headache.
Right.
So it's a early morning severe headache with projectile vomiting. The vomiting should be, it should be thrown away from the body, so we
Okay.
call it as a projectile vomiting.
Mm-hmm.
This is one of the very common symptoms of the brain tumors with raised brain pressure.
Okay.
So this is one thing.
Hmm.
Any headache associated with imbalance,
Mm-hmm.
any headache associated with hemiparesis or weakness of the body, any headache associated with double vision. Okay, so these are the any headache associated with personality change.
Correct.
Sometimes old age, we think that the because of the old age he's behaving something differently, or sometimes we attribute that to a different psychiatric disease also.
Right. Right.
But many a times, if you do a imaging in that cases, you will find a tumor. So these symptoms have to be taken very seriously
Serious.
and shown to a neurosurgeon
Correct.
as soon as possible.
Right. Right. So, what are the main treatment options which are available for brain tumors?
So once you get to know that there is some tumor
Hmm.
in the brain,
Right.
first thing you need to do is to consult a neurosurgeon,
Neurosurgeon.
right?
Right.
Second thing, you should discuss in details with the neurosurgeon about the treatment model, as you are
Right.
rightly asking me.
Yeah.
But more than that, you should not panic.
Correct.
You should not Google it.
True.
Because many a times the experience of a surgeon, the clinical acumen, we call it as, that matters a lot. Because the Google information might be misleading. Most of the time it is true, but it could be misleading.
Right.
So what you need to do, you need to tell your family that look, I have got something in the brain, I need to treat it with the help of a neurosurgeon. So visit your neurosurgeon.
Right.
Okay, ask him what are the treatment modalities.
Correct.
So what are the treatment modalities? There are 3-4 treatment modalities. Sometimes there is a incidentally detected lesion, we call it as incidentoma or incidental finding. For example, if you have a sinus problem, you go for a the screening MRI,
Right.
and you find a small meningioma somewhere in the brain.
Okay.
It's not causing any problems,
Mhm.
so you can ignore it.
Right.
Because the meningiomas, the indolent tumors, they grow. Not all meningiomas, the grade 1 meningiomas, they grow at very small pace, means very little pace, like 1 to 2 millimeters in a year.
Okay.
So if a 70-year-old lady comes to me with a 6 millimeter meningioma, I will not operate it.
Correct.
So that has to be understood. So that is the one thing.
True.
So we can conserve it. We can just do it serial imaging. We can see the pace or the growth rate of the tumor.
Correct.
So that is one thing. Second thing, if there is a large tumor which is causing symptoms, then it has to be operated.
Correct.
Operation is done for two reasons. One is to relieve the pressure of the brain. As
Right.
we have discussed, brain is a very concise portion. It's a very concise structure. It is enclosed structure, so it doesn't have the space to grow. So anything which comes as a foreign material, as a
Correct.
tumor,
Yeah.
in this case, that will cause pressure in the brain.
Okay.
Okay, so it has to be dissipated, it has to be relieved. So first and foremost reason for getting operated to relieve the pressure in the brain.
Pressure. In the brain.
Secondly, we should get the tissue diagnosis. What is tissue diagnosis? What kind of tumor it is? We have discussed about the types of tumor.
Yes.
So what kind of tumor, it falls into which category? So that is important, because the next line of action depends upon the type of the tumor.
Correct.
So that is very essential. Right, the tissue diagnosis. We can grade the tumor also. If it comes to be glioma, we have to grade it with the help of a neuropathologist. So grade 1, grade 2, grade 3, grade 4. The meningiomas are only grade 3, grade 1, grade 2, grade 3, like that. Every tumor has a different grading. So we have to grade the tumor and then treat it accordingly.
Okay.
But first and foremost treatment is surgery.
Got it.
So what are the tumors in the brain which are treated non-surgically? Okay, so first I told you incidentomas.
Yes.
Small tumors, we can ignore it because it is not causing any pressure or any kind of symptom.
Correct.
So we have to just serially monitor them. That is first thing. Second thing, some tumors, we have discussed about the brainstem, right? Some tumors, like brainstem tumors, they are situated in such a space, we cannot reach that space. Only few exceptions, like cavernomas, we remove it from the brainstem, but most of the brainstem tumors, like brainstem glioma, we don't take biopsy also.
Okay.
We can directly subject them to radiation.
Radiation.
The prognosis is not good.
Hmm.
So this is the second thing, right? First is incidentoma, small tumors. Second is brainstem tumors. Sometimes the secondary tumors, the metastasis we call it as. These tumors are multiple in number, or they are arising from such a part of the body, or the histopathology of such tumors is such a malignant, is having the growth potential to such an extent
Hmm.
that we cannot remove it primarily.
Correct.
In that case, means very malignant secondary tumors,
Hmm.
that case we don't offer surgery.
Okay.
Okay, so multiple malignant tumors, incidentomas, and
Hmm.
brainstem gliomas.
Got
These
it.
are the three scenarios where we don't offer surgery.
Right.
But apart from that, every tumor has to be operated
Operated.
by a neurosurgeon.
Correct. Right.
So the primary
So
treatment is surgery.
surgery. Correct. Actually, you answered my the other question also. That was basically between the doctors how they decide
Right.
whether to go for surgery first or radiation or
Correct. Correct.
chemotherapy.
Correct. Correct.
So, are there any new treatments available in this horizon?
Yeah. So new treatment we can divide into many parts. Means the treatments which are in on an experimental basis.
Correct.
They are not tested on human beings. Uh, there are many treatments for gliomas basically.
Hmm.
I'll tell you. We can divide it into two parts basically.
Hmm.
What are the newer modalities which help us to remove the tumor,
Right.
and what are the novel treatments which are available or which are being proposed. Okay. So as we have discussed already about the gliomas, the very common tumors,
Yes.
we call it as the intraaxial tumors because they are arising from within.
Hmm.
We call it as intraaxial. It's a very technical term.
Correct.
So these intraaxial tumors, we need to remove the tumors as much as possible to extend the life of a patient,
Right.
or to cure them in a
Hmm.
way.
Hmm.
Okay. So for that, there are many modalities. One is a navigation. Second is a fluorescence imaging. Okay. Then third is a neuro monitoring.
Mm-hmm.
है ना? There are many techniques like endoscopic treatment of the tumor. है ना?
Right.
So we can discuss, and fifth is very important, is awake craniotomies. So these five we can discuss in very little because we have constraints of the time
Yes.
also.
Yes.
So navigation system is just like a we use Google Maps on
Mm-hmm.
daily basis.
Yeah.
Yeah, so this is a very common thing which we use. So similarly, in the enclosed part of the brain, we don't know where exactly the tumor is situated.
Right.
So we have to capitalize on that portion where the tumor is situated. We
Right.
cannot go haywire. We cannot remove the normal part of the brain, or we
Right.
cannot go to the normal, because all the brain is important.
Correct.
It's vital. We cannot remove the normal part. So for that, the navigation system, there is a software which superimposes the imaging with the actual skull. So we can actually navigate through the skull,
Mm-hmm.
the part of the brain which is having tumor.
Correct.
So that helps us to have a very little incision, smaller craniotomy, smaller removal of the bone, and smaller incisions on the brain tissue,
Mm-hmm.
or lesser damage to the brain tissue.
Correct.
So this is a navigation system. It is a very important tool for a neurosurgeon.
Mm-hmm.
Then is a fluorescence imaging. What is
Got
a
it.
fluorescence imaging? Fluorescence imaging, it depends upon it. It relies on the metabolism of a tumor.
Right.
So tumor preferentially uses a different metabolite than the rest of the brain.
Mm-hmm.
We don't want to go into the technical part of
Technical
it.
part.
So we give a dye,
Mm.
we inject a dye. So that is being selectively taken by the tumor.
Mm.
It emits some radio fluorescence, which is taken up by the microscope.
Okay.
So effectively, we can only see the tumor, not the rest of the brain parenchyma.
Mm.
So we happen to remove the tumor without damaging or without touching even the normal brain parenchyma. So
Correct.
this is a very good. We have that in Bhaktivedanta.
Bhaktivedanta
Yeah,
Hospital.
we have that. So this is a second thing. Third thing is awake craniotomy. So awake craniotomy is a very important tool. Why? Because strangely, brain itself is pain insensitive. It gives such a pain to us, but itself is not very sensitive.
Right.
The covering of the brain, dura, we call it as a dura, it is pain sensitive structure. So what we do is we anesthetize the patient till the time we open the dura. So
Okay.
once we open the dura, the patient is awakened.
Mm-hmm.
Why? Because some part of the brain controls the motor functions, the opposite side movement. If the tumor is arising from that part, which is controlling the opposite side movement,
Right.
we can remove the tumor while talking to the patient, while asking the patient to move the limbs.
Okay.
So that helps us to remove the tumor without damaging those fibers which control the opposite side movement. Then the speech area tumor, we have discussed about the speech.
Speech.
So if there
Yes.
is some tumor in the vicinity of the speech area,
Hmm.
we can actually map the speech area
Right.
and remove the tumor without damaging. We can ask the patient to talk while operating.
Wow.
Even some patient play music, some artist, we have operated that. So basically this is a very good innovation,
Right.
that we remove the tumor while talking to the patient. So
Wow.
this is awake craniotomy.
Okay.
Then comes the neuro monitoring,
Hmm.
neurophysiological monitoring.
Yeah.
You must be knowing about the ECG.
Hmm.
We have the graphical
Yes.
representation
Right.
of the heartbeats or heart
Yes.
activity.
Right.
Similarly, we have neurophysiologist, which can represent each and every nerve, each and every fiber of the brain
Mm-hmm.
graphically during the surgery.
Hmm.
We require a special anesthesia for that. We have well a trained anesthetist in our setup. So what we do, for example, we are operating a tumor near the cranial nerve. For example, acoustic schwannoma we are operating, it is in the vicinity of the seventh nerve. Seventh nerve is controlling the facial movements,
Mm-hmm.
the smile, right? So basically it's a smiling nerve. It controls the test sensation also. So while operating on that, we can monitor the facial responses, right?
Okay. Hmm.
Even the nerves which control the deglutination, the lower cranial nerves we call it as. So
Hmm.
we can monitor their function also,
Mm-hmm.
right? So during this surgery, we can, it acts as a third umpire basically, in short.
Okay.
So whatever we do, if it is in the vicinity of the nerve,
Mm-hmm.
the third umpire, the neurophysiologist, will ask us to stop there,
Got it.
right? So this is a very important tool, neurophysiology. It is very important in even the spine tumors also,
Mm-hmm.
right?
Yes.
So it is very important tool.
Got it. Got it.
So these are basically the few newer innovation. There is
Hmm.
a stereotaxy also. It again, for the depth of the tumor, it's a deeply seated tumor, we can actually go in the depth of the tumor. Stereotaxy is just like a rocket launching. We can reach that point which is
Point.
required
Correct.
and remove the tumor, that's it.
Right.
So this is also a very important tool in the modern neurosurgery.
Correct. Right. Right.
Then the new things like robotic surgery is coming up, the 3D printing is coming up,
Hmm.
AI tool, which is, so many things are coming up. DTI imaging, we use it routinely. DTI is, we can track the important tracks, like
Hmm.
the track which controls the opposite side movement. This kind of track, sensory tracks, we can track this, uh, all the important fibers during the surgery.
Got it.
So we call it as a DTI imaging. These are the important tools for surgery.
Hmm.
But I'll tell you a story. The the modern neurosurgery, the father of neurosurgery, Dr. Cushing, he had removed one tumor, glioma. He removed from one lobe. It recurred on the other lobe. Then he removed that lobe also. He recurred on the other side.
Oh.
So the gliomas are some notorious tumor. They can recur on any part of the brain, but it doesn't go outside the constraints of the brain. That is again a difference between other body
Other
tumors and
body.
the tumors in the
Yes.
brain.
Hmm.
It doesn't go. It is a very well behaved tumor in that aspect. Okay, so the bottom line is that for gliomas, the surgery is option definitely, but we need to develop some drugs to prevent the spread of the tumor within the brain itself.
Hmm.
So these are notorious tumor, they will definitely recur.
Mm-hmm.
Okay, so we are in a process of developing near vaccines also.
Mm-hmm.
Some gene therapies are working. Some drugs like bevacizumab, or we call it as very drugs. Many drugs are being
Yes.
developed
Yes.
so that to arrest the growth on a very initial stages.
Mm-hmm. Got
Okay,
it.
but again, these are all experimental drugs.
Right.
Nothing has been concrete innovation in this aspect.
Right. Correct.
One more thing, there is a very good innovation of stereotactic radiosurgery. We need to discuss that also. So what is stereotactic radiosurgery? It is not a surgery.
Hmm.
It is basically a radiation.
Hmm.
But there are some side effects of radiation. What are those? It can cause memory loss, it can cause radiation necrosis, it can actually hamper the quality of life, the
Hmm.
cognitive functions of the brain. It can hamper.
Hmm.
But if you deliver the focused radiation to the center of the brain,
Hmm.
it can reduce the damage to the surrounding.
Understood.
So we have used this navigation to actually focus on the center of the brain, so on the center of the brain
Center
tumor,
tumor.
right? So we call it as, in our language, stereotactic radiosurgery, SRS. There are many, like proton beam therapy is also being developed. It's
Right.
already developed,
Hmm.
but the indications are actually, we are scrutinizing the indications of it, and it is very, very effective.
Correct. Correct.
So both the proton beam therapy,
Hmm.
SRS, they are very effective tools.
Right. Correct. So, we request our participants who are listening to this live podcast to check the ticker which is running at the bottom of your screen, which has some important contact numbers to conduct such kind of sessions for your congregation. Also, on the screen, you will see our offerings, which is 24 by 7 helpline number and online chat services. For more further details, connect to us and you can take the benefits and advantage of Bhaktivedanta Hospital. Here you can see our offerings, that is special health talks and webinars. 24 by 7 helpline number. The number has been displayed on the screen to book an appointment on priority basis and to facilitate emergency or any other queries. Also, you can take the benefit of our online chat services, that is Ask Bhakti. You can visit our website www.bhaktivedantahospital.com and you can chat with us on the WhatsApp number, that is 8400146262. Also, you can scan the QR codes for the hospital related information and to join the ISKCON community. You can share this information to your community as well so that you can percolate this message in future. So we talk about the patients who are living with a brain tumor now.
Yes.
So how can brain tumor patients maintain their mental health and emotional well-being during the treatment and recovery part?
Yeah, it's a very emotional part of it,
Yes.
because to have a patient with brain tumor in a family consumes a lot emotionally. I
Yes.
understand that, we deal with that regularly,
Hmm.
but for that we should have many supports. The support system has to be very, very aggressive.
Hmm.
um, we have to deal with it on various basis. For example, uh, we have a comprehensive management of a brain tumor at our setup. So it's a multidisciplinary basically approach towards the brain tumor.
Hmm.
Surgeon is the cornerstone, definitely, but we have got a very good psychiatrist associated with us, psychologist associated with us, physiotherapist, occupational therapist. So these all, speech therapist,
Hmm.
these all people together will help the patient to deal with these problems.
Okay.
For example, if the patient has a tumor in the, we say, in the motor area,
Mm-hmm.
so there will be some weakness of the body.
Hmm.
So the physically patient has to be rehabilitated.
Okay.
So basically the rehab, we call it as a rehabilitation.
Yeah.
So we have a very good physiotherapist. We have a center of
Yes.
physiotherapy
Yes.
as well as the occupational therapist.
Hmm.
So the job of a physiotherapist is to maintain the tone of the muscles
Correct.
which are losing the power.
Hmm.
So that is one thing. The job of an occupational therapist is to enhance it to the extent that they can work normally.
Mm-hmm.
So these two people will help the portion, the physical portion of a disability.
Correct.
But as you rightly said, the emotional portion is very difficult to manage.
Yes. True.
It takes a toll.
Hmm.
But what I need to tell my viewers, the channel viewers also, that all brain tumors are not cancerous. We need to know that. And even if they are grade 3, grade 4 tumors, there are many treatment options available.
Right.
We need to actually take the services into consideration, all the services into consideration. And we need to support the patient. We should not panic. We should seek the help. Huh?
Yes.
So basically, our psychologist and the psychiatrist,
Hmm.
they help you to the first reaction to any tumors is denial. So I cannot have this,
Correct.
right? Then the fear.
Yes.
Then you have to cope up with that, and you have to have the hope of living,
Correct.
because everything, as we know, is in God's hand.
Absolutely.
We are small human beings.
Hmm.
So we need to know that.
Hmm.
So I have seen GBM patient, the grade 4 patient, surviving for many years, and the data we suggest is less than 2 years of life.
Absolutely. Absolutely.
So we have to keep faith. The
Correct.
faith
Right.
is very important.
Right. Right.
So patient, this is one thing. Then the important part of other part of the rehab is nutrition. So we should have a good dietitian
Hmm.
which can maintain the muscle mass, which can give a the diet plan, so that you can support the treatment.
Correct.
Your body should support the treatment.
Yes.
So this is basically a team approach.
Correct. Right.
Right.
So I think the support networks, including the
Absolutely.
family, the medical, or the community, actually it is beneficial,
Absolutely.
during the
Absolutely.
recovery.
Absolutely.
So, sir, how does a patient can manage the side effects from the treatment, such
Right.
as cognitive or physical
Right.
impairments?
uh, the management of the side effect is little difficult.
Yeah.
So the prevention is easier. So we have seen
Yes.
in details how can we prevent the side effects of the treatment.
Hmm.
For example, the most common side effect of surgery
Hmm.
is a disability. Like if you operate in a speech area, patient can lose the speech.
Hmm.
If you operate in the motor area, patient can lose the power.
Right.
So we have developed, the science has developed so much that we can operate without causing much disability.
Got
So the prevention is better. So to go to a proper person,
it.
or importantly, I need to tell this, because to person is one important part, but to reach out to a proper hospital,
Hmm.
we should not operate this in a nursing home.
Hmm.
Nursing home is not a right place, even if the surgeon is good, because surgeon should have a good infrastructure,
Correct.
because it's, as I told you, it is a multidisciplinary uh, approach towards the
Yes.
patient. We should
Yes.
have that.
Correct.
So you need to choose a proper hospital, you need to choose a proper doctor.
Hmm.
Right. So that is most important. Yes, but once they develop, we can minimize it with the help of a physiotherapist, with
Right.
the help of the occupational therapist,
Hmm.
speech therapist.
Hmm.
That is one thing.
Hmm.
Radiotherapy side effects, there we have a radiotherapist, radiation oncologist, we call it as. They are very much aware of the side effect, and they prevent that by
Right.
delivering the correct dosage.
Hmm.
And the chemotherapy, we have an oncologist. We The oncologist will deal with it very in a very effective manner.
Got it. Got it.
Yes.
Uh, how can a person return to his daily routines or daily
Yeah.
life and work after recovery, especially if they have experienced physical or cognitive changes?
Yes. So that is what we have discussed. With it requires a support system,
Hmm.
basically a family support, even the medical support, physical support like physiotherapist, speech therapist,
Hmm.
and occupational therapist. The
Right.
occupational therapist has a bigger role to play in this,
Hmm.
because occupational therapy will help you to develop the skills which are required, suitable for your job.
Correct.
So that system has to be there, inbuilt system has to be there in the hospital, so that the patient recovers fully.
Hmm.
It is not only the surgeon, the physiotherapist, the occupational therapist, they are all equal part of the team.
Hmm. Hmm. Hmm.
So
Right.
surgeon is a smaller part.
Right. Right. Right.
It is the
Right.
face, but it is a smaller part.
Right.
The rehab is more important, as you
Correct.
are rightly asking me.
Correct. Right.
Right.
So, after the surgery of a tumor in brain, are there any recurrence chances to
Yes.
have it?
So we there are many aspect of the recurrence. First of all, the type of the tumor.
Hmm.
Type of the tumor, if it is a grade 4 tumor,
Hmm.
or even the grade 3 tumor, they are they are very vulnerable tumors. They can recur, as we have told.
Yes. Right.
The second part is the extent of excision.
Hmm.
If there is a meningioma,
Hmm.
if a surgeon removes it completely,
Hmm.
then chances of recurrence are less as
Okay.
compared to the half resection.
Hmm.
So again, you should reach out to a proper surgeon so that you remove the tumor completely,
Hmm.
and the chances of recurrence are less.
Good.
But
Yes.
primarily, the tumor decides
Hmm.
it will recur or not the
Okay, the
surgeon.
tumor decides. Okay,
Yeah.
got it. So, requesting the participants, if you have any questions, please you can just mention it in the comment section. So, we have one question, sir. Are brain surgery risky, fatal, or lead to handicap situation?
Yes. So brain tumor surgery is not at all fatal. Okay, and not at all leading to handicap situation.
Okay.
Okay, let me clear that, because the modern neurosurgery is developed to such an extent
Hmm.
that the tumor mortality, we call it as a mortality, it is
Right.
very less.
Hmm.
It is more than normal hernia surgery,
Hmm.
but it is very, very less than previous the mortality rates.
Right.
That is one thing. The morbidity, we lessen it with the help of the technology.
Hmm.
Apart from the surgical skills, the technology is very helpful
Hmm.
to reduce the morbidity. So, to answer your question, sir, in a very simple language, no, there is very less chances of mortality and morbidity in brain tumor surgeries.
Okay. Okay. Uh, what would be your advice to someone who has newly diagnosed a brain tumor?
As I told you, if don't panic, first advice.
Correct.
So don't panic. Tell your family, take everybody's opinion, and go to a proper doctor
Hmm.
who has got a tremendous experience in dealing with brain tumors.
Hmm.
Then find a place, the hospital,
Hmm.
not only the surgeon,
Correct.
the hospital which has all these facilities,
Hmm.
as we have discussed in details. What are those facilities? So a hospital should have all the facilities available. Hospital should have all the rehab facilities available.
Yes.
Hospital should have this team approach,
Hmm.
multidisciplinary approach towards, all holistic approach, we can uh, concisely tell it, that holistic approach towards the patient.
Hmm.
And we have a spiritual care also at our place, that
Yes,
also
we
is
do
very,
have.
very important.
That is a
Because
unique
yeah, unique part
special.
of our hospital,
Yes.
Bhaktivedanta Hospital, the spiritual care. I have seen, Yogiraj, I have seen many patients, they develop a very positive attitude towards the life
Absolutely.
with the spiritual care.
Right.
So that, see, it has to be there, that positive attitude. That
Absolutely.
positive attitude will lead us
Hmm.
to that the treatment also differs in patient with negative approach and positive approach.
Hmm. Hmm,
I'll
hmm.
tell you that the positive patient will live longer.
Correct. Right.
Okay, so be positive and reach out to proper doctor in a proper hospital.
Right. Correct. So again, requesting the participants to check your ticker running at the bottom of your screen, which has the contact information to conduct such kind of sessions. So we have one question: how
Yeah.
far is brain tumor surgery successful, and what is the rate of success in India?
So, a rate of success definitely depends upon the institute and the experience of the surgeon.
Hmm.
But an experienced surgeon in a proper setup, the rate of success is more than 95%.
Great.
It's very, very uh, hopeful thing for everyone,
Hmm.
that the rate of success is very high,
Hmm.
95%.
Right.
Yeah.
Correct. Again, you can see on the screen the offerings what Bhaktivedanta Hospital is giving under the flagship program of ISKCON Devotee Healthcare Services, that is 24 by 7 helpline number and the online chat services. So you can see the contact numbers and you can share it with your relatives, your friends, and your within your circle to avail the healthcare facilities at Bhaktivedanta Hospital, which is located in Mira Road, Mumbai.
So I
So,
can share some good anecdotes. Like
yes.
one patient of mine
Hmm.
was a young chap. I will not disclose his name.
Hmm.
Young chap, 17 years old. He had a big brain tumor
Hmm.
in the cerebellum, which was compressing and going inside the brainstem.
Hmm.
It was not going inside, but it was compressing the brainstem. Patient came in an unconscious state in our hospital.
Hmm.
Uh, so our we have got a very good emergency room. They diagnosed it in a few hours that patient is having this brain tumor with hydrocephalus, means
Hmm.
we call it as the pressure in the brain, the ventricles, the ballooning of the ventricles, the
Hmm.
cavities in the brain.
Right.
So that patient, we took it, patient was unconscious completely. The pupillary reaction was also sluggish.
Hmm.
We discussed with the relatives that there is need of an emergency surgery, and we as a team we removed the tumor completely. The patient was unconscious before surgery. It took some time for the patient to regain consciousness, and I'll tell you, the patient was tracheostomized also. There was a hole we had to make, because patient was very morbid before surgery.
Hmm.
It took a while for him to recover,
Right.
and I'll tell you, this patient is now doing engineering.
Right.
So it is 3 years back. He's in second year or third year of engineering. So this kind of he was a devotee, our
Hmm.
own devotee, and this kind of success stories we have. But we need to have a positive approach,
Correct.
right team behind it, and
Right.
rightful uh, intervention is required
Correct. Right.
with the facilities available, as I told you.
Absolutely, sir.
Yeah.
So, I would like to appreciate like you have shared the inspiring stories of individuals who have actually overcome and they have managed their brain tumors. So, thank you so much, Doctor, for
Thank you.
giving us the insights about the today's podcast, which was on the journey of brain
Yeah.
tumor from diagnosis to prevention. So we will meet with you guys with the another exciting health-related topic with another expert. So till then, just take care of your health and stay active. Hare Krishna.
Hare Krishna. Thank you for inviting me. Thank you. Thank you.
Thank you,
Hare
sir.
Krishna.